Hit record. All right. Welcome everyone to another North Suburban YMCA Education Series talk. Thank you for joining us today. My name is Pam Rakansky. I am the YMCA YES facilitator here. We are so lucky to have Denise Schwartz with us today from the Manual Touch Physical Therapy. Hello, Denise. Denise is a licensed physical therapist who specializes in treating pain using a holistic approach to discover the root cause of pain and provide natural healing options. We love Denise. She comes every month to us. Today, Denise will be talking to us about healing neck pain naturally. I know I'm interested. So with that, I would like to introduce Denise. Thank you for joining us. And Denise.
Thank you. All right, I'm going to thank you for that nice introduction, Pam, and I'm always love doing these. I am going to share my screen. You might want to, let's see, where did it go here? So Pam, stay on a second. I got to make sure everything shows up okay. Okay. You can see the PowerPoint is good. Let me do one more thing. Can you see my mouse or not yet? I think I have to do this. Hold on. Here we go. Okay. Can you see the mouse? Pam, can you see the mouse now?
Yep.
Okay, great. Okay, we are good. Well, welcome everyone. We're going to talk about how to heal your neck pain naturally. My name is, as Pam said, I'm Denise Schwartz. I'm a physical therapist and owner of the Manual Touch Physical Therapy in Wheeling. I'm just at the corner of Milwaukee and Dundee Road, so we're at the edge of Northbrook. We use a whole body approach of traditional and non-traditional therapy to get people back doing the things they love to do. When I got out of school many, many years ago, I knew that back pain was the #1 reason people went to see their doctor. So once I got out of school, I started taking a lot of classes on how to heal back pain, which goes along with neck pain, and became quite an expert in that, learning some traditional techniques on how to heal back and neck pain. Along the way, I certainly learned took a lot of classes on treating the rest of the body as well. Along the way, I started learning a non-traditional technique called integrative manual therapy, and I found that I was able to help people that I couldn't help with the traditional therapy. So a lot of people with chronic pain, fibromyalgia, people who are very sensitive, did really well with my non-traditional therapy, as well as everybody else did well with it too. So at that time, I left the hospital that I was working at. I was working at Lutheran General, and I opened up a clinic here, Center IMT, with my mentor. And we worked with a lot of complex pain, complex medical patients using these non-traditional hands-on techniques. I was with them, I think, 7 years, and then we parted ways in 2010, and I opened up the Manual Touch Physical Therapy here in Wheeling. And what I realized is a lot of the traditional stuff that I had sort of thrown out when I was learning the non-traditional were still really good. So I combined both traditional and non-traditional therapies of exercise and hands-on therapy to get people back doing what they love to do. Along the way, I had developed a passion for running, and I became an expert in treating runners and triathletes as well. So today, we're going to talk about neck pain. Now, as we're all used to by now after a few years, when we're in person, we can be much more interactive. I could ask you what your complaints are, what the problems you're having. But since we can't do that, I'm just going to kind of go through and discuss the slides. If you have any questions, please save them for the end or put them in the chat box. And we will get to them at the end of the show and the end of the presentation. I'd be happy to answer any questions that you have. Usually, if you have a question, someone else has it, so it will be helpful. If it's a very personal story, I'd be happy to talk to you at another time. And I will leave information on the PowerPoint on how you can reach me. So neck pain. What are some of the common complaints people have when it's actually coming from your neck, or possibly coming from your neck? We have some people will complain of head pain, like headaches, neck pain, or arm pain. So the head pain can go up the back of the head. It could be up into the jaw. They could have pain up into the forehead as well. Arm, hand numbness, tingling, or pain is very common. The most common, I would say, is people have lost mobility in their neck, that like I can't turn one way or the other. Headaches. Some people have vertigo or dizziness. Weakness in the arms or hand. And then how it affects them, people have difficulty sleeping, they have difficulty driving, walking, working on their computer, grooming, doing your hair, washing your face, brushing your teeth, writing, reading. All those things can be affected by having neck pain or arm pain. So today we're going to talk about the 4 most common causes that I see here in the physical therapy clinic. There are certainly other things that may be much more devastating that we wouldn't see here, but these are the most common. And if you're walking around and you have neck pain or arm pain, and more than likely it's possibly one of these things. So we're going to talk about arthritis or stenosis, herniated disc, a musculoskeletal problem, which is the majority of people has this, with or without one of the other two, the arthritis or herniated disc. And this is more, musculoskeletal is more of a postural weakness or in the soft tissue. And then I sort of divided this up into more of a skeletal issue as well. And I'll explain what that means as we go on. This is an ebook that I have available that I would love to send to you. So if you leave me your email and your name, first and last name, in the chat box, I'll be happy to send this to you along with this presentation. So then you can always have these tips available at your fingertips. This is called Mindful Tips for Pain-Free Daily Movements. This will give you tips on how to function every day in your life. People don't quite realize that the majority of your symptoms or problems could be caused by all the everyday things you do: sitting down, walking, standing, sleeping. I had a whole slew of people where we just had to adjust their sleeping posture, and a lot of their neck and arm pain went away. And most of it had to do with where their arm was positioned in their sleeping. And we can talk about that a little bit more as we go along. So this is your spine when looking from the side. Oops, sorry. Your neck is made up of 7 cervical vertebrae. And then you go into what's called the thoracic spine, and there's 12 of those, 12 thoracic vertebrae, and there's 12 ribs that attach to each of those vertebrae. And the bottom is your 5 lumbar vertebrae, and down here is your sacrum, the coccyx, and this is your pelvis. Okay. I give another talk probably sometime later this year talking about lower back pain. Today we're talking about neck pain, which actually encompasses some of the thoracic pain as well. As you can see, our spine is supposed to have a curve inward, then out, and then in. We have official names for that. The inward curves are called a lordosis. So the cervical spine and the lumbar spine have a lordosis, and the thoracic spine has a kyphosis. This is the front. If we're looking at you from the front, as you can tell, this is your skeleton, your face of skull. This is the front of your cervical spine. And what I want you to notice here is your rib cage. This is your first rib. It is all the way up into your neck region, into the soft tissue of the neck. So a lot of people are very surprised when I tell them this, because this can be a big part of the issue that you might have if you're having neck pain, particularly if you're feeling really stuck or you woke up and you slept funny. What else here? Oh, this is your This is your clavicle. This is your arm bone, the humerus, and these are all the ribs. You can see here's the back rib and the front ribs. here is a side view. Okay, and I want you to notice here, this top cervical vertebrae, look how close it is to your jaw and your ear. So sometimes people will have some pain going on in their jaw and their ear that may or may not be coming from their neck, or it might be vice versa. You might be having TMJ issues, which is your temporomandibular joint, which is your jaw. So it could be referring back and forth. You could have some ear pain. It could be coming from the neck or the jaw as well. And so you can see here, you got your 7 cervical vertebrae. In between, here's the front of your neck, and here's the back. This area is your disc that's between each vertebrae, which we call the vertebral body. Okay. Behind the vertebral body, you can see this yellow is your spinal cord that goes down through the center of each vertebrae. In between each vertebrae is a hole, which we call a foramina, and a nerve comes off of the spinal cord, goes through the foramina, and goes down to your arm. Okay, so all these nerves in your neck go down to your arm into different areas. The whole spine is like this. Is the spinal cord. There's nerves coming off of the spinal cord all the way down, and they go to different areas of your body. But for this purpose of the discussion, it's from your neck going into your arm. In the middle of this disc, I don't think I have a picture of it. Oh yeah, here it is. All right, so this is a side view, but you can tell from this side view that half of the vertebrae is cut off. So it's like a cross section of it. And so we could see into the center of the spine. Okay, so we cut off half of the vertebrae, the vertebral bones. Here's the back end of the bones. This is the disc in between. And here's your spinal cord going down in between. Okay. In this disc is what is a nucleus, and that's like a jelly-filled donut. And what sometimes happens when people have a herniated disc is this nucleus starts bulging out onto the edge of the disc. There is a ligament that surrounds the disc called your annulus, and that nucleus pushes out on to the annulus, kind of bulges, and that can press on the nerve. So when people have a herniated disc or bulging disc, the official name is a herniated nucleus pulposus, or HNP. So if you see that on some documentation that the doctor writes when they write a prescription, that's what that means. And it presses on the nerve. For stenosis, stenosis means a narrowing. So what happens is you get a narrowing around the spinal canal, and it could, and the most serious end, really compress the spinal cord. But more often than not, it's compressing the nerve coming out of the spinal cord. Sometimes, and I see this a lot, is people develop, and stenosis is a form of arthritis, is you get a narrowing in this foramina where the nerve is coming out, and it's called foraminal stenosis. And a lot of people have impingement there. This is the back end of your spine, okay, just so you can see it, another version. And you can see how close, obviously, it's at the base of your skull. And, you know, a lot of people might have pain right at the base of the skull here. There are some muscles here. And there's actually, I don't have a picture of all the muscles that surround the neck because there's so many. And there's so many little ones. There's little ones in between each of these vertebrae. There's little ones here at the top of your spine connecting to your skull. Here you can see how there's a big long muscle that goes from your base of your skull all the way back on your neck, and it goes down around your shoulder and back to your upper back. The interesting thing about these little muscles here is these hold your head on straight. So when you move your eyes, these little muscles fire. So if you have a good sensation in your fingers, you can put them at the base of your skull. And if you look to the right and the left, you'll feel those little muscles kind of fire. I think that's a very interesting piece. So sometimes vision is an issue when people have something going on in their neck or they have headaches coming from the back of their skull there. So when someone comes into physical therapy or to their doctor's office, we ask them a lot of questions about their symptoms, what's bothering them, what can't they do, what's difficult. And based on a lot of your subjective information, will give us some clues as to what's going on. So if it's arthritis or stenosis, this is some of the common things we might hear. People feel very stiff in their neck. They can't move very well. They might have numbness, tingling, or weakness in their arm. Oftentimes it could be in both of their arms. People usually complain of neck or arm pain in the morning. They might hear crunching noises. And they might have difficulty doing shoulder checks in the car because they can't turn. So they really have to turn their whole body, which is not a bad thing. And we can talk about that more a little bit later as well. A lot of people when it's arthritis and stenosis, it's kind of a remitting pain, which it kind of comes and goes. Some days you feel okay, and then some days you don't feel good. Those are pretty much big clues. Sometimes we'll see loss of reflexes, sometimes we don't. Sometimes people have numbness, sometimes they don't. And sometimes they have weakness and sometimes they don't. A lot of times when it's arthritis and stenosis, if it's not super significant, although it doesn't feel good, you won't have the symptoms into your arm. You'll just have the neck really stiff and it's painful. And a lot of people do really well getting a shot. And we're going to talk about what we do in therapy for you. Where people really will have changes in they'll have arm symptoms, numbness, tingling, weakness, loss of reflexes, is really when a nerve is impinged. And more often than not, that's a herniated disc. If you're getting a nerve impinged that badly from the stenosis or the arthritis, that's pretty significant. But here, when it's a herniated disc, there's a lot that we can do for that. So people will have numbness or tingling in their arm, or weakness. Usually it's very, we can reproduce it, like they turn their head to the right and they get numbness down their arm. When they turn their head to the left, it goes away. That's usually pretty consistent with some sort of herniated disc or impinged nerve. People might have loss of sensation in their arm. And as I said, certain head positions reproduce the symptoms. What I most often see, and this can be a standalone or it goes along with the other two diagnoses, okay? People will come in and tell me, I just woke up and I slept funny and I can't turn my head. That often is what I call an elevated first rib. So remember, you see this rib right here? The neck muscles all cover that rib. And when you lay funny, or sleep funny, or your head side bent for too long, or you turn quickly, that rib kind of locks up right against this first thoracic vertebrae. And it's kind of like having something stuck in your tooth, in between your teeth, where there's really nothing that can take that pain or discomfort away except getting the thing away from your tooth. It's the same thing here. People with this, they feel really awful. They have a lot of pain. It may travel up into the back of their head, down the back. They can't turn at all. Advil and Tylenol doesn't seem to help. Heat or ice doesn't help. Really, what helps that elevated first rib is a treatment technique that we do here in physical therapy. It's very easy. One of these days, I'm going to make a video of it to take care of. It happened to my sister-in-law recently, and I got onto Zoom with her and my brother, and I talked to my brother how to treat it, and the pain was gone the next day. So she did not have anything that was obviously a herniated disc or stenosis. She just had this, I slept funny, and things locked up on me, and we had to take care of this first rib. I do find that people with stenosis or herniated disc might still have this as well, which will help reduce the pain when we take that down. Something else that we might find, again, there, like I pointed out, there are lots of little muscles between these bones here, and they can kind of spasm and cause these just minute little shifts in the spine, which will limit the way that you move and the quality of movement. So we need to get in there and gently mobilize those vertebrae. We're not popping or cracking. We're just kind of facilitating it to get back into better alignment so we have better quality of movement. I kind of liken it to, so if you can see my hand, let me see here. Sometimes I don't look at myself here. Okay. So, you know, I can't extend my fingers actively, but I can push this up like this. That's what we call normal joint play. And so a lot of times what we're looking for is, what is the joint play in the vertebrae? And, you know, we get our fingers on there and mobilize, and it might be stuck in one place, but another place it moves okay. And so some of our treatment techniques are to get better balance and play in there, just like being able to bounce this finger here. What surprises some people, a big issue that happens that limits your neck mobility is the upper thoracic spine. So a lot of people who have sat for their jobs their whole life have a very stiff upper back. Okay, and so when you turn your head, the upper part of your thoracic spine should move as well. But if it's very stiff, that could be the limiting factor. So we got to really work on mobilizing that place as well. I talked about people who might have jaw pain or ear pain. You could have headaches or migraines. Some people have vertigo, and we call it cervicogenic vertigo. And it has to do with all that limited mobility and that joint play in the vertebrae. And we have to get in there and mobilize that. I have a woman right now, a young woman who's had migraines her whole life. She's 32. And someone offhandedly mentioned, one doctor mentioned, you know, it could be myofascial. So she came in for the first time for physical therapy in her whole life. She's had migraines since she's 12 years old. And sometimes, you know, it's not my expertise to figure out where the migraines are coming from, but if it's coming from the neck and the soft tissue in that area. So I've been working on her, and she's now down to maybe one migraine a week, where she got it almost daily, and she can manage it really well. So apparently her neck played a big role in her migraines. It's not always the case, but it's often influential. The other way we can look at musculoskeletal neck pain is from the soft tissue themselves. So a lot of people have heard of whiplash. Whiplash is literally in the front of your neck are muscles. And when we have whiplash, what happens is we get thrown forward and back and forward. And so what happens is you strain the anterior, the front muscles in the neck. And that hurts quite a bit. What I see more often than not with people is it's literally just postural weakness. So I've got a lot of young people who come into me who aren't used to sitting all day long at work. They're sitting like this. And their big complaint is they have pain at the end of the day in their neck and upper back. And that's literally due to postural weakness from down below in your core. If you've heard of your core muscles, those are all your muscles between your diaphragm and your pelvic floor. And when those don't work so well, then your neck can't sit where it belongs. So here, if we look at posture, here is perfect posture, which nobody has. Okay, everything is lined up. But look at where your neck is in relation to your hips and your core. But here, if we have someone who has an increased kyphosis and lordosis, look at the neck here. So because of what's going on down here, your neck has to accommodate in your head, thus you get neck pain. Again, here's someone who's bent over, the neck is flexed over, the muscles fatigue, you get neck pain. Here's someone who slouches, their head is forward, again, neck pain, okay? So when you come in for physical therapy, oftentimes I am working below your neck so you can get up straighter and your neck can sit in a good place like these rocks. So if this rock was sort of tilted funny, then this head rock here would probably fall over. But let's say they're all glued together, and then you would sort of, everything would be sort of askance. So we need to get your base. And sometimes it's all the way down in your feet. This picture doesn't show it very well, but oftentimes I have to work on your feet and ankles in order to get your neck to calm down and relax so it can start working optimally. Another soft tissue issue I have found is in the front of your neck. Again, there are little muscles here. Anybody have asthma or COPD? They will overuse these muscles here to breathe. And they will also, you can see some abdominal or rib cage muscles working as well. So my daughter was at 2 years old, was diagnosed with asthma. When she was having an asthma attack, you could see her. Let me see if you can see that. So she'd be breathing into her neck. So you can see how those muscles fire there. I had a woman that was her neck pain. She couldn't diaphragm breathe down here. She was using all these muscles up in here, and she had neck pain. And she didn't have a herniated disc or stenosis. It was just all soft tissue. Okay, upper back pain is also very common. Base of the skull, we talked about how that can affect your vision. That woman who, with the migraines, she had base of skull pain. It was pretty restricted there. The upper cervicals weren't moving very well. The joint play was not good because of the soft tissue there that was very tight. We talked about different posture here. We want things lined up as best we can. You know, as we get older, things change. People with osteoporosis develop, various spinal changes. People with arthritis change their spine. They may have a scoliosis. And so we have to really strengthen up all these muscles and tissues around here to protect your spine. So how do we know if physical therapy will help? Well, first we want to know, is the pain reproducible? What does that mean? You turn your head and you go, ouch, that's reproducible. You turn your head, oh, my arm is numb. That's reproducible. So we usually can help with those things because there's certain specific movements that cause the pain, numbness, or tingling, and we have some tools for that. So you don't necessarily, the first line of defense isn't typically medications or shots. Hopefully your doctor sends you into physical therapy right away because we have better luck when you come in sooner than later. And we can reduce that. And the biggest mistake people make with neck and arm pain is they ignore it. If you wait too long, then it can kind of blow up and you get all sorts of other symptoms and problems. It's really much better to take care of it sooner than later. We can take care of it much better and quicker. Getting stronger can take a while, but we can maybe get that pain reduced. I threw this in here. I went to Alaska last year. And this is a glacier called Exit Glacier. And you can see this is a year marker, 2005. The glacier in 2005 was all the way to this sign. This is how much it's receded. There were signs all along the path getting there on how much it's receded. And it's been a lot in just a short period of time. So I don't often give exercises out in these programs because it depends on what you really need. Okay, so it depends on your diagnosis, it depends on what's causing the symptoms and pain, and where do we begin? It's very important. However, there are things that you can do to take care of yourself that are in this book. So remember to put your email in the chat box so I can send this to you. It's tips for sleeping, for sitting, for standing, for walking, all those things that hopefully will reduce a lot of your pain. I had a woman, and she was waking up with numbness in her arms and hands. And sometimes you might think, oh, you have carpal tunnel because it's into your hands. But in her case, it was because she was sleeping with her arms over her head. So don't do that. In fact, I just told a woman this morning who, she sleeps like this. So I said, you got to bring it back down. A lot of people do is they kind of sleep with their wrist all bent like this. And that's kind of will cause some carpal tunnel. So we have to change those positions. Three years ago, I fell and broke my right arm and hip, followed by months of physical therapy. I still have issues with my neck, back, and hip and knee, which Denise has explained are all related. She has this new set of eyes and an old problem and has helped me immensely. I have learned new exercises for my neck, back, and hip, which have made a difference in my pain and mobility. This was a pediatric physical therapist. I saw a whole slew of them a few years back. As you know, a physical therapist who working with kids, they're doing a lot of lifting with kids who are disabled. And so it's taken their toll on them. Here was a woman, she had left shoulder and neck pain, was getting progressively worse. So she came in to see me and she said I helped her quite a bit. There are only a few PTs that possess skills like Denise. I'm happy to report that I am pain-free and sleeping through the night. And she can do her yoga. Here, I came in to see Denise due to cervical disc herniation. I had 6 weeks of PT at another location, but still was unable to turn my head fully or work at desk without terrible pain. After seeing Denise and following an exercise program, I was almost back to normal within a few short months. And now I saw her son as well. So what do we do here in physical therapy? Well, we've talked a lot about them. One of them is hands-on therapy, and those are those traditional and non-traditional techniques that we will do to get better joint play in all the joints. We'll work on the soft tissues to reduce anything that may be contributing to your pain. We will work on certain movement patterns. You're going to get a lot of instruction on how to help your posture get better alignment. What we call body mechanics, how to function daily, how to lift, how to move so you don't aggravate your neck. And then you're going to get a lot of strengthening exercises and neuromuscular exercises. And what are neuromuscular exercise? That is teaching your body how to work together. So they'll be specific, particularly from the bottom up, getting your feet working with your core, getting all that stabilized so then your neck has a nice stable place to live. In addition, there will probably be some not really specific neck exercises. They're core exercises that work on your neck and your upper back as well. We have to work on stabilizing that. It's kind of like your upper back is like a core of your upper back muscles. So as a thank you for attending this webinar, I'd be happy to do a phone call or a telehealth session with you to discuss what's going on with you and give you my recommendations. Oh, did I draw that? I don't know. Eraser. There we go. Go back to mouse. Okay. Here are actually some tips that I'd like to give you. We talked about sleeping a little bit, about not having your arm over your head. One thing you want to do is have a good pillow, no matter what position you sleep in. A side sleeper, you need a pillow that fits within your neck here. You don't want your head side bent, so you want to keep it in neutral. The same thing when you're laying on your back. You don't want to be extended or flexed too much. And I never recommend sleeping on your stomach. When you sleep on your stomach, your head is turned all the way, and it will cause early degeneration in your neck. It will cause worse degeneration in your neck. So I help people train them how to not sleep on their stomach. You can, however, be sort of half on your stomach by having a large body pillow in front of you. It's what a lot of pregnant women will do. And so you're half on your side and half on your stomach, and your head is only partially turned. If you safely can do this, this is a simple little exercise that you can do. I often don't teach movement from your head. I teach movement from below. So it's moving your body on your neck. So if I cross my arms and I turn my body, I am turning my body on my neck, and my neck is getting more movement. This will often feel much more comfortable than trying to force your neck to turn. So be cautious, do it slowly when you do that as well, okay? You can also side bend a little bit. Until you can get in to see us or the doctor, you can use ice or heat. And if you are working with a personal trainer or do exercise, you want to make sure you are strengthening your core. That will give a nice stable place for your neck to sit, okay? And we'd work on that a lot here. This was Alaska again when we went kayaking. I just wanted to share that because it's just beautiful. Here's another beautiful picture from Alaska. And thank you for being here. This is how you can reach me, my email and my phone number. Please feel free to email me with any questions. And again, if you put your email and your first and last name in your chat box, I can send you this PowerPoint presentation as well as the ebooks. I'll leave this on for just a moment and we can start answering some questions.
Any questions from the group? Thank you, Denise.
You're welcome. Let's see, I'm going to look in the chat box here.
Mostly our emails, which I already have in an email for you.
Yeah. Oh, we have a person who is a dentist. Oh. Boy, I tell you, being a dentist is really hard on your arms and your neck. So this is, I don't think I have a name. Oh, Paula. Probably, Paula, you need to come in for us to really see what exercises will be best for you. However, I had a dentist a number of years ago where we worked on the best thing. Think about using your body, which is what I did with the pediatric therapist as well. I think way back in the day when I was in school, we sort of learned how to stabilize really hard and just kind of move like this. And that's not good. You want to use your body when you're doing it. So as a dentist, if you're sitting, you can move your chair around to different positions. Make sure you're leaning and hinging through your hips. So those are some ways you can maybe start protecting what's going on with your body. And that's what you'll see in my Mindful Tips book, is how to shift and use your body when you were reaching and doing things. Let's see. Someone wrote that she turns her head gently. It's okay to do that, but when you're really stuck, forcing it is really not very comfortable. So using from down below is better. Okay. And did anybody else have any questions?
All right. Well, if you do, feel free to email myself or Denise. Denise, let's put your email in the chat box. I can do that.
Yeah, I can do that right now. And then
I'll close out.
And
all
then
right.
If you have, again, anybody else want to put their email in the chat box?
And have those emails ready to go to you.
Yeah,
All
hold
right.
on. I have to copy it. Give me 1 second here. I always
You're
forget
good.
how to do this. Oh, here it is.
I already copied it too, but great.
Oh, you copied it? Okay.
Yeah, to get it ready for you, and then.
Oh, so you copied the chat box? Okay, awesome. It looks like there's some people still putting in, so.
I'll grab it before we end. All right, I'm going to close out. The YMCA education series is free.